We begin tonight with Meriter nurses in the hospital back at the negotiating table today.
Hundreds of nurses are striking to get a contract that addresses safety concerns and provides better staffing standards. But as our Ellie LaLiberte shows us, the impact of the strike has gone past the picket line.
The strike started on Tuesday morning, and ever since then, it seems like the care has really gone downhill.
Sophie, who asked to stay anonymous and change her name for this story, has been in Meriter Hospital for nearly a week.
I arrived here to the ER on Friday with pancreatic issues.
She's been going to Meriter for care her whole life. But this visit, she says there's been issues.
I have been consistently late for my medications. IVs are not getting flushed in appropriate amounts of time. Mistakes have been made when it comes to administering certain medications.
Meriter contracted hundreds of travel nurses in preparation for the strike. But Sophie says she and other patients feel like the hospital wasn't prepared.
I have constantly had to advocate for my care, and luckily I know my chart very well, so I'm able to do that. But for some patients, that might not be the case.
No, it's management's job to provide staffing, and it is our job to provide the care.
Pat Reyes is a Meriter nurse of 35 years and the president of SEIU Wisconsin, the union that represents the nurses. She says she's sad to hear stories like Sophie's.
It is concerning.
But after 23 rounds of negotiating, the nurses felt they had no choice.
We are fighting for the future, and unfortunately, the basics are the basics.
The hospital, however, says it's not aware of any specific patient complaints at this time and denied claims that operations aren't running smoothly, saying, quote, "We are consistently hearing feedback from patients, family members, and our providers that these travel nurses are providing incredible care, and we are so grateful to them for showing up and giving our patients their all." But patients like Sophie want the nurses who they know and trust.
We want our nurses back, like point blank period. They are what keeps Meriter running.
Shut it down! Reporting in Madison, Ellie LaLiberte, News 3 Now.
Ellie, thank you. The hospital declined to say exactly how many travel nurses were brought in, but says they have received thorough training and preparation for the strike.